FAH is by design. And when we were building this organization, we were very intentional that the organization needs to reflect the population it serves. We are an Africa-based, Africa-led, and Africa-focused technical advisory and trusted strategic advisor to governments on primary and community health financing strategies. The problem that Financing Alliance for Health is working to solve is predicated on two numbers: 50% and $4.4 billion. Less than 50% of the African population is able to access affordable and quality health care at the time of need, at the point of need. And more than 50% of the burden disease across the continent is preventable. Our solution is African, at scale, and system-based. We've been privileged to serve more than 22 African governments across the continent. And through our support, governments have been able to commit more than $32 million on their actual Ministry of Finance budgets towards primary and community health system strengthening, which has then catalyzed additional investments in country and also within the larger ecosystem of up to $500 million. It's not just about the money, it's what the money can do in country. And that money has been able to support the key 8 elements of a well-supported community health worker. We have been able to support more than 4,000 stakeholders and upskilling them in health financing and giving them the skills and tools to be able to advocate for increased financing for community and primary healthcare systems in their countries. For us, innovative finance, it goes beyond just the design of an innovative financing solution. It's about how do we become innovative in who invests in the solution and who gets to co-design the solution and how that solution can be impactful more long-term. We co-created the Africa Frontline First, which will be able to institutionalize more than 200,000 community health workers across more than 10 countries by 2030. One key initiative under the Africa Frontline First is the catalytic mechanisms. The Africa Frontline First Catalytic Fund was an innovative financing solution where we're able to mobilize private and philanthropic investments from our friends and colleagues at Schwab Foundation and J&J Foundation and Ventures to invest in a multilateral institution, the Global Fund to fight TB, malaria, and HIV and AIDS. The value of social innovation is that it begins with the problem, and most of the time the problem is one of the most pressing problems and challenges in the world that don't always immediately have a viable business model to solve. And so social innovators identify interventions and stack those interventions and solutions in a way that builds a pathway to sustainability over time.